In the next half hour, and full hour in fact, KXAN News offers a unique opportunity to get in-depth answers from the leaders charged with keeping Austin well. Good afternoon, I'm Robert Hadlock.
Thank you for joining us. I'm Britt Moreno. We are taking your answers directly to these doctors who are on the front lines of the pandemic and treating patients in our local hospitals.
KXAN News presents Keep Austin Well, an interactive COVID town hall.
The pandemic forces isolation, closures, masks, and fear. Then there's hope and relief as vaccines bring us together again.
Now, a dangerous variant infects quickly and strains Central Texas hospitals. But the circumstances keep evolving, and our solutions now are different, informed by time, experience, and science.
Joining us later in the second half hour of this town hall on KXAN are Austin Mayor Steve Adler and Travis County Judge Andy Brown and Austin ISD's Director of Health, Alexandra Copeland. We are here without masks, so our communication is clear to you.
But we do want to let you know that for safety this afternoon, each person in our studio was tested for COVID and screened for any symptoms. And perhaps most importantly, we have all been vaccinated.
Here in the studio right now is Dr. Desmar Walkes, the health authority for Austin-Travis County. Dr. Walkes has 33 years of experience in healthcare as a family practitioner and medical director.
Now you can see just behind Dr. Walkes, we have three doctors joining us virtually today, and these are experts in their fields of medicine. So we start off here with Dr. Anna Vu Wallace, who specializes in internal medicine.
And in the middle of your screen, we have Dr. Pamela Cooper, who is also an internal medicine physician.
On the right side of your screen, we have Dr. Natasha Kathuria, who is an emergency medicine and global health specialist. They all have extensive experience working here in Central Texas hospitals. Now, we do want to let you know there is still time to send in your questions. You can use the hashtag KeepAustinWell. You can also email us at reportit@kxan.com.
And our first question for our doctors is this. We'll direct it to Dr. Walkes. What are you seeing in our hospitals right now, doctor?
Well, unfortunately, we are experiencing an so high surge in case numbers in the past 3 to 4 weeks. We've gone from having 70 cases a day that we're seeing of new cases to almost 600 cases of new cases a day. And right now in our hospitals, we have 477 people admitted to hospital with COVID-19, and 161 of them are in ICU, 100 people on ventilators. So we've come to a serious time in our community.
A lot of people often ask, are those people in the hospitals right now vaccinated or not vaccinated?
Almost all of the people, unfortunately, that are in the hospital right now are unvaccinated.
You know, I want to open it up to our panels. If you all don't mind, we'll check behind you, Dr. Walkes here. You know, one thing that we hear is this is different than the last time when we were really in the depth of the pandemic. How is it different?
It's different on so many levels. It is a rapidly spreading virus, more contagious, as you know, as the original COVID variant. It is affecting the younger populations so much more severely. If you want to look at the numbers, currently about 10% are between 20 and 29, 10% between 30 and 39, 12% between 40 and 49, 17% between 50 and 59, and you know, as actually they get older, the 80-plus-year-olds are at 13%. So this was not the case as it was back in January when we were seeing predominantly older people. And in fact, there are actually 14 children, I believe, hospitalized right now with COVID-19 pneumonia.
And Dr. Kathuria, this is happening during the midst of a nursing shortage in the whole country.
Right. It's been extremely challenging for us. I mean, from the ER, you know, we have a constantly revolving door. We never shut our doors. And when things back up in the ICUs and in the hospital floors, it backs up onto us in the ER. And so our ERs have been functioning well over capacity for quite some time now with no real end in sight. And we have severe nursing shortages statewide and even nationwide. And so that's making it even more challenging because our hospital capacity is limited because we don't have enough staff and nurses at this time. So we're over capacity already, and we're, short on staff. So it's very challenging. And just as you said, younger patients, there's several people on ECMO right now, and which we just chatted about a little bit earlier, that the youngest patient is 19 and the oldest is 39. That's not the same demographic we had during either of the last surges we dealt with. So this is very concerning this time.
We often worry about running out of beds in the ICU. Do you think that we would ever return to having an option, supposing that we do hit that threshold? Will Austin open up another place for people to go? Dr. Walkes?
We have plans in place that would allow for us to open up an alternate care site if we need to. But right now we're working closely with our hospital systems, and they are able to manage what the capacities that we are seeing right now, but that could change at any moment, which is why we are making this plea to the community to start wearing masks, everyone to wear masks.
And Dr. Vu Wallace, you wanted to add something, I believe.
I was just saying, absolutely. The curve that we're seeing and the amount of people being admitted right now is so sharp that I'm concerned that the surge is much sharper and the peak will be higher than what we have seen in the past. And I believe that we will need to make accommodations for another facility to be open.
One great thing about this is that we've opened up questionings to all of our viewers. So we have one here from a parent. This is Jessie Potts. Take a listen.
Are we able on a local level to get some sort of mask mandate into our schools for those of us who have children that cannot get the vaccine? Thank you so much.
Okay, so her question, what is your advice for parents with those children under 12 who are not eligible for the vaccine? Big question is, should you send them to school or should they take class virtually? Dr. Vu Wallace, let's open it back up to you. What do you say to that?
As a physician, I can say definitely that our children are at risk. With Delta, all bets are off. We don't know what this will do in our pediatric population. We're seeing it in real life right now as we're seeing higher and higher hospitalization for children. We're seeing higher infection rates for children than we did previously. Mm-hmm. So yes, I remain very concerned, and as a medical professional, I strongly advise parents to have masks on children 2 years and older, to go to school with all the safety precautions in place, with distancing in place. I think we have to push for that. I would hope that our teachers and all the adults who come into contact with children who are not vaccinated to also have the mask on. And with both sides masking, we do know protection it's at its best, because that's all we have right now for the children. As far as mandate, I will have to defer that to our local officials.
Well, later in this hour, we're going to hear from Austin's mayor and the judge in Travis County, the county judge. After a short break, we're back with our doctors live.
And we're going to ask them about what they're hearing from unvaccinated patients. Why aren't they getting the shot? That's coming up just ahead. Welcome back to Keep Austin Well, an interactive COVID town hall. We are taking your questions to the experts here in Central Texas.
And just in this evening, the number of Texans hospitalized with COVID-19 has climbed to 7,436. For context, just a month ago, there were less than 1,700 COVID hospitalizations statewide. More than a quarter of all occupied ICU beds statewide now have a COVID patient in them. Our next question, I'll ask it to Dr. Cooper. What are the most common reasons you're hearing from some people about why they're not getting vaccinated?
There's probably several. The first one is probably the most popular, is that the vaccines, they thought they were too quick to develop them, and so people mistrust that. The second reason I think is just vaccine hesitancy. That's been around since the 1800s. When vaccines were first introduced to our society. That's a tough one because you can convince somebody that the vaccines are safe, even though they were developed very quickly. But in my opinion, mRNA vaccines they've been doing research on them for the last 2 decades. And it was with that research that they were able to propel how quickly we could obtain this vaccine. And then there's the propaganda that is what to me is the most frustrating part of this. It's not based on science. It's not based on valid data. It's just based on people's opinions. And that is a really tough one to tackle.
In talking about opinion, Dr. Kathuria, I'll direct this one to you. Some people say, well, the vaccine doesn't even work. What would you say to them when they suggest something like that?
I would make it very clear that an overwhelming majority of the patients being hospitalized, and every single patient I've personally admitted to the hospital with COVID-19, is unvaccinated. The majority of our patients on the floor, in the step-down units, in the ICU, are unvaccinated. Of course, there are exceptions. There are people with transplants who are, immunocompromised, who don't respond well to the vaccine, and they can get critically ill from COVID even after getting vaccinated. But we've never had a more clear picture that the vaccines are working phenomenally well. We have breakthrough infections, of course, and we anticipated that. We have that with every vaccine. But the patients who are getting COVID after being vaccinated are doing remarkably well. And even if they get hospitalized, they turn around really quickly and get discharged home. And that's what we care about, is those who are getting sick and those who are dying. The ones who are really falling very ill and getting critically hospitalized are not vaccinated.
And Dr. Walkes, this
and
must
it's
be
heartbreaking because it's so incredibly preventable. That's just the bottom line. It is preventable.
And as a public health official, Dr. Walkes, this must be frustrating to have people so hesitant about taking this.
It is, because vaccines are so widely available. They're free. They don't require an identification, and it's a shame that folks aren't getting out there and getting it done. And to go a little bit more into the point about the vaccines protection, it's protected the senior citizens that we reached out to in the very beginning when vaccines were first deployed. And although we're seeing some cases in our nursing home population, for instance, there are very few of those residents that develop COVID-19 after vaccination that require hospitalization. They have very mild illness and they usually can stay in the nursing home setting. So this has done the job of protecting people from becoming severely ill, requiring ICU care, and it has been able to prevent death. Vaccines really are doing their job.
Dr. Walkes, thank you so much. And still ahead in our town hall, we go to the Austin Director of Health to answer your questions. So we'll take a short break and then we'll return with our doctors.
And we're asking them about protocols, what to do if someone tests positive. Has that changed? KXAN, we've been taking your questions to the experts here in Central Texas we have gathered. There's still time to send in your questions. Just use the hashtag #KeepAustinWell or email us at report@kxan.com.
And we are getting so many great questions. Here's one of them from Wade Wilson. Wade, thanks for this. He says, what are the protocols when a restaurant has workers test positive for COVID-19? Dr. Walkes, we'll direct this to you since it's regarding protocol. We can actually maybe expand this and talk about protocols for any business here in our city. What would you say to Wade?
Well, we are asking that the person return to their home to safely self-isolate in a separate room with a separate bathroom. And if they're unable to do that, we have at Austin Public Health and through our EOC isolation facilities available for Austin and Travis County residents. The restaurateurs will identify close contacts and they will have those individuals quarantined. And they are very adept at this procedure. Overall, the restaurant community has done a really amazing job in Austin at mitigating the spread of COVID-19 and have had very few cases. So,
our panel brought up breakthrough cases, so we do want to talk about that a little bit as well. We want to talk about reinfections and breakthrough cases. Can someone who has had COVID get COVID again? What about if they've been vaccinated? So Dr. Wallace, do you want to take that one on?
Certainly. As far as reinfections, this is very rare. I think it's only been a few incidental cases. As far as vaccination, can you still get infected? Certainly. The vaccine is not 100%, but it does protect you. 97%. It does protect you from severe illnesses as well as hospitalization. Or in our ICU, we do not have anyone who's intubated and is vaccinated. Now, we have had breakthrough cases in patients with underlying comorbidities. We see patients who are immunosuppressed, such as organ transplant patients getting infected and does have serious hospitalization because of their underlying disease, because they're just not able to produce antibodies even with the vaccines.
Dr. Kathuria, we've heard a lot about herd immunity. Getting to that will be okay. Can you expand on that?
Yeah, we would love to get to herd immunity. Right now, we're just hoping to get to 50% of Texans fully vaccinated. We're still not even at that mark. And it will take us quite a bit to get to herd immunity at this rate that we're at right now. But that's really important because the risk of breakthrough infections then drops dramatically. You have enough people vaccinated, then even if there are new variants, it's going to be difficult for it to enter a community. But as long as we continue to have pockets of unvaccinated people, even if the rates of unvaccinated people are low, if there's large areas where there are lots of people unvaccinated, that's an at-risk group where it can easily, re-enter the area, spread like wildfire, and new variants can pop up. So we're very concerned about that. And that's exactly what happened right now with the Delta variant. It entered communities with high unvaccinated rates and spread from there.
Well, still ahead, parents in the Austin ISD will hear directly from the district's director of health. This is an interactive town hall, so next we ask our panel some questions coming in from you, our viewers, right now.
And we'll ask about the latest COVID-19.
Let's get to our next question. Can any of your doctors tell us about the latest treatments that are available? Who wants to take that one?
Any takers? How about Dr. Cooper?
So the treatments really haven't changed very much since the beginning surge in January. Basically, if you get hospitalized and you are requiring oxygen, you are put on a drug called dexamethasone, which is a type of steroid, which has been proven to show improved lung function. And remdesivir is the other drug that you get a 5-day infusion worth, and that's been the one that's shown to reduce the length of hospital stay. There's also a monoclonal antibody called tocilizumab, which is I think that's more given to the patients that are becoming more critical and heading to the ICU, and that's a one-time dose. The convalescent plasma, I think that's been more used in the outpatient setting, and it is not being used very much in the inpatient setting anymore.
What about antibody infusions?
And usually those are reserved for patients who are, I think you're talking about a monoclonal antibody that's used as an outpatient, and we have one specifically inpatient that Dr. Cooper has already mentioned. But there are two types of treatment for monoclonal antibody, but they're reserved for COVID patients who who have higher mortality risk, greater than 65, diabetes, hypertension, heart disease, and so forth.
All righty, thanks to our doctors. And we do want to say thank you, a heartfelt, earnest thank you for all that you do for us. We do appreciate you taking time out of your busy day and joining us here in the KXAN studio. When we come back, we have more questions as well as an insight here to Austin ISD. And we'll take you live. Here's a picture here of a town hall that is about to take place for parents there at AISD, and that is coming up next on KXAN.com.
And for everyone who's vaccinated, the latest research on booster vaccines.
KXAN News presents Keep Austin Well, an interactive COVID town hall.
Well, good evening to you. Thanks for joining us here on KXAN News at 5 p.m. This is a special day. This is an interactive town hall we're holding with local medical experts, and we're also going to talk with Austin's mayor and the Travis County judge a little bit later on in the hour.
And 1 hour from now, Austin ISD is holding their own town hall for parents in the district. KXAN's education reporter Alex Capriello is moderating that. Alex.
Yeah, good afternoon. I'm joining you right now from Austin ISD's Performing Arts Center. The stage behind me is where I'm going to be speaking to AISD's leadership team, answering all the questions that you folks have been pouring into us about what school is going to look like in just a matter of weeks. Up on stage, first and foremost, is Superintendent Dr. Stephanie Alisalde. She has her entire team. But for right now, for this town hall, we're going to be speaking to AISD's Director of Health Services. That's Alexandra Copeland. Alexandra, thank you so much for joining us today.
Thank you for having me here.
I think the very basic question that we want to know is in-person learning, what it's going to look like for the students that come back to campus. So can you outline some of the very basic plans and guidelines that you have set up for in-person schooling?
Yeah, absolutely. So we have a lot of our health and safety protocols still in place that we had last year because we know that they're effective and they keep our schools safe. So we will be strongly encouraging everybody to wear masks. We know that that works, and that's one of the most effective ways to lower the spread of COVID-19. We will have people there that can provide rapid testing whenever somebody needs it. We're also going to continue to have our vaccine clinics, and also classrooms are going to be full this year. We're going to have plexiglass there, lots of hand sanitizer, and again, lots of our health and safety measures still present.
Now, some of the health and safety guidelines that you had last year have been taken off the table. In specific, I'm thinking about the temperature checks and then the on-site screening questionnaire that students were required to show. Can you give us some insight as to why those were removed? A lot of parents wrote into us and said, you know, with masks not being required, we really feel like that would be a great way to maybe prevent spread of COVID-19 with just those two guidelines.
Yeah, that's a really good question that we keep getting. So temperature checks. So for one, at the beginning of the pandemic, we thought that the temperature checks were really effective. And what we've learned just from the research and from our medical community is that temperature checks are not really as effective as we thought they were. So what we're seeing is a lot of times if people have symptoms, they won't necessarily have a fever, especially our students. So that's kind of one reason why we took it away. Another reason is that sometimes when you do temperature checks and it's outside in the elements, it can affect the temperature and it's not an accurate reading, and we want accurate readings. So those were the two main reasons. As far as screening goes, we're encouraging people to screen before they leave their home. So if you're sick, we want you to stay home. We don't want you to come to school when you're sick and we screen you. So we really are asking that families and students come together to do that at home, as well as our staff to make sure that we don't come. Now, if people show up and they visibly have symptoms, then we will have support there and the nurse there that can help and treat the student as well.
Yeah, a lot of it comes down to, you know, parental or familial supervision, making sure that if that's your choice, that the family makes it sure that masks are worn, or that the family is ensuring that, you know, those sorts of green lights are a go before even coming to school. So can you tell us a little bit more about sort of the encouragement or what sort of messaging that you're putting out there for families to follow their own guidelines?
Yeah, absolutely. So in all of our communications, we are strongly encouraging mask wearing. At AISD, we're a family, right? And it takes everybody to come together to keep everybody healthy and safe. And so wearing masks worked in our classrooms last year. We did not have any outbreaks that were for in-person learning or in the classroom. And so we're really asking everybody to come together and wear their masks, especially since we're in stage 4, about to go into stage 5. And also, we're asking our leaders to lead by example. So as you can see, I'm wearing a mask right now, and a lot of our leaders have started to do it, and we will see that on the campuses when school opens.
You brought up a good point about the outbreaks. Obviously, that's not something that anyone wants, but there is always a risk. There's always a chance. And at the latest Austin Public Health guidance meeting from Austin Public Health, they showed the positivity rate of school-age children. For high schoolers, it was all the way up to 28%. For middle schoolers, it was 18%. So the question is, if a transmission were to happen, if an outbreak did occur, what exactly happens, and what happens with students, and what happens with the teachers and the other staff that are present and are exposed?
Absolutely. So one thing that's unique about AISD is that we have a public health team, and I'm part of that, and we have 2 other members. So every single COVID incident that we have goes through the health services department, and we do contact tracing. And what we do is we quarantine any close contacts, and we also ask people to stay home if they're symptomatic or they've tested positive. We also continue to consult with our local health authority, Austin Public Health, when we need to. As of last year, we did not have any outbreaks that were related to in-person learning or classroom learning. Any outbreaks that we had from extracurriculars, and so we will continue to follow these protocols next year, even though a lot of surrounding districts aren't. But our priority is to keep our students and our staff and our families safe, and so we're going to continue that practice into this new year.
I have one more question for you, which is a bit forward thinking, and perhaps we're not even there yet, but Austin ISD made an effort to get the students 12 and over vaccinated when that was approved. We're still waiting for that FDA emergency use authorization to vaccinate kids 12 and under. Do you plan on having this district mobilize again when that message does come down and that is okay for the students 12 and under?
Absolutely. So we're actually still mobilized now. People can visit the AISD website under the health services page. We've been doing a summer COVID-19 vaccine tour that's still continuing. We are expected to have hubs going into the new year. And when that vaccine becomes available to our kids that are under 12, then we will continue to do those pop-up clinics and those hubs to make sure that we have the vaccine available to as many students, staff, and community members as we need to.
Okay, in Copeland, thank you so much. You heard it, vaccine clinic still going on for Austin ISD. If your child is up and hasn't gotten the vaccine, and that is something that your family wants to do, make sure you're going online to find out. This town hall is going to begin at 6 p.m. It's going to go for 1 hour. You can find it on KXAN News and KXAN.com. We'll see you there.
Thank you. Right here on our town hall on KXAN, we'll bring in another expert in medicine to ask about the latest research and what's now being called the Delta Plus variant.
State health leaders now say this latest wave of the COVID-19 pandemic is shaping up to be the worst yet.
Data shared this afternoon by the Texas Department of State Health Services shows the 7-day average of new cases is up 92%. Hospitalizations and deaths are also on the rise. The state's epidemiologist says anyone who is not vaccinated should wear a mask in public, including children.
The Texas Department of State Health Services says the vaccine is an essential tool to fight the Delta variant.
We know that these vaccines work, even against variants like Delta. We know that no vaccine is perfect. They never will be. And so there will be some breakthrough cases. And this is especially true for people who might not have a strong immune response to the vaccine in the first place. People like immunocompromised people. But most vaccinated people are protected from getting sick with COVID-19, including this Delta variant.
Joining us live from Washington to answer more of your questions is Dr. Kavita Patel, a fellow at the Brookings Institution, also a proud UT grad. She's also an NBC News medical contributor.
Thanks for joining us, Dr. Patel.
Thanks so much, Britt and Robert, for having me.
Well, today the WHO called for a moratorium on booster shots as poorer countries are still waiting for COVID vaccines. But we have received a plethora of questions regarding booster shots. Do we all need one? I think is one of the biggest questions.
Yeah, great question.
Will be offering booster vaccines. I know both Moderna and Pfizer have talked about the need for a booster, but there's no official guidelines yet. I'm a UT student who has to go back to campus in the fall, and I'm very interested in a booster.
Okay, forgive me, Dr. Patel, that is one of our viewers who jumped in there to ask the question, but you heard it straight from him. You know, what is the latest research that you are experiencing regarding booster vaccines? Do you feel like these are going to be a staple for us?
Yeah, great question. So I do think that boosters are in all of our future. It might not be, for just directly to answer the viewer's question, you do not need a booster today unless you do fall into one of those very kind of specialized categories. About 4% of the population who have had organ transplants, HIV medications, cancer therapies, on other chronic medications that are specific and can suppress your immune system. They are likely to be the first best populations to get a booster. But if you are healthy and do not have a specific condition, your current vaccines do protect you. And while I think that our our future does hold some more shots for us. It may not be the third dose of an mRNA vaccine, Robert and Britt. It might be a totally different set of vaccines that are tailored for the different variants. And the pharmaceutical companies are actually working on that right now. And that's what's more likely to be something like a flu shot, kind of on a yearly or maybe every couple of years basis.
We've heard so much about variants. We all know Delta variant by now, but we've also had a confirmed case of the Lambda variant in Houston. And now we're hearing about a Delta Plus variant. Can you talk a little bit about these?
Yeah, so look, it was inevitable that Delta, just remember, it was only short months ago that we were talking about Alpha, the variant that originated in the UK, as being the most predominant, which it was until Delta came. So Delta Plus has a lot of the mutations the Delta variant has, but some additional mutations to that red spiky protein, which we are worried could make it even more of a threat than the Delta variant. The Lambda variant, as you commented on, is something that we've seen in South America, but we're now obviously first cases in Florida, Texas. I like to tell people by the time we're picking it up, it's a lot more widespread than we realize. And that variant also has a series of mutations that make it potentially more deadly. And so we're watching all of this closely. Here's the way to think about variants. Every time the virus replicates, it has a chance to mutate and get a little bit smarter. By getting vaccinated, we prevent the virus from replicating and having that chance. Until the majority of the world is vaccinated, though, we will still be hearing about these variants.
Dr. Walkes, final question. What is the latest CDC recommendations on social distancing?
We continue to have people social distance by separating themselves by 6 feet and wearing masks. And I want to put one last dig in for get vaccinated, please.
You're hammering that one home.
Yes.
That's what's important today.
Yes.
Thank you so much to Dr. Walkes and Dr. Patel for joining us this afternoon. We do appreciate your time. And up next, Keep Austin Well Town Hall continues. We are sitting down with government leaders, the mayor, and a local Travis County judge to ask why the criteria has changed for entering Stage 5 risk-based guidelines and how soon we might get there. Well, good evening and welcome back to Keep Austin Well. This is an interactive COVID town hall, and we are taking all your COVID questions and then bringing them to our local leaders. And this evening we have Austin City Mayor Steve Adler joining us, as well as Travis County Judge Andy Brown. Thank you both so much for being here with us.
So we're going to begin with a question we've been hearing a lot about lately as we've reported that the city and Travis County are moving closer to Stage 5 risk-based guidelines. First, there's been some people expressing confusion and frustration for sure that the criteria and the guidance for entering Stage 5 has changed from the last time around. Can you help us understand what Stage 5 will look like and why? Mayor Adler.
Well, I understand the frustration as rules change. It's hard to keep up, but this is a meaner virus that we have dealt with in the past. It's adapting, so it's important that we adapt too. So there are going to be new guidelines that come out for people to be able to see, but basically it divides the community into 3 different groups. If you're vaccinated, then you have more ability, more freedoms under the guidelines to do things. Go out to eat at a restaurant, especially a restaurant that's requiring people to be vaccinated to go in. If you're vaccinated but a high-risk individual, then you should have extra precautions. I wouldn't go to a big crowd, even wearing a mask if I was a high-risk person, even if I've been vaccinated. If you're not vaccinated, those are the people most at risk in our community, and those are the people that we're recommending under Stage 5 pretty much stay home when you can. Don't be out with people because we see how this mean virus is going after the unvaccinated.
When might we see Stage 5 become in effect?
Pretty soon. We obviously we're doing everything that we can to try to get people to get vaccinated, to wear the mask, and that's what this really is all about. Is do we want this to be a surge that lasts a really long time, or do we want to do all the right things, wear a mask, get vaccinated, and we get through it a lot quicker that way? That's really the question. So I think it's coming soon. I would imagine, and really the question is, are people going to do the things that the doctors that we just heard before are asking us to do?
One thing I've heard from communities of color is that it's really hard to access the vaccine, or there's a certain mistrust with getting the vaccine. So what would you all say to those communities? How easy is it to get a COVID vaccine this day and age, and what is your recommendation for people?
Well, you asked two questions, and the first one is how easy it is to get it. And we all know when this started, it was hard to get the vaccine, and everybody was looking everywhere to find it. But we're literally going door to door virtually with the opportunity to get vaccines. I think there were 40 different places you could get a vaccine this past weekend. So the opportunity is there. But you touch on the second point, which is kind of the distrust or people wanting more information. And maybe you could understand that at the beginning, but now the vaccine's been gone to billions of people. We know just how incredibly safe it is. We know how effective it is. And boy, I tell you, listen to the doctors, and just hearing that 90% of the people in our hospitals are the unvaccinated, that virtually everybody on ICUs are the unvaccinated, that's real important information for people to have trust in this vaccine.
Did you want to add anything, Judge?
Yeah, I mean, everything has changed so much about this virus and about the vaccines. At first, we were doing it, at Circuit of the Americas, large drive-through things, and then we are now doing it, like the mayor said, door to door. I think on Tuesday, the Commissioner's Court just added another 6 people to help with the team that Constable Morales and Chief Bailey are running in eastern Travis County, East Austin, because there are still people who, they have to work. It is hard to find the time sometimes to get the vaccine. And so that's why we're encouraging employers to make sure to give time off for people who want to get the vaccine, make it easy for everybody to get the vaccine. And as the county and the city, we're working together to make sure that we're going to where people are to give them the vaccine and make it as easy as possible right now.
Thank you both so much. And we have been keeping up with all of your questions that you keep sending in to us.
KXAN's Will Dupree has one for our local leaders here this afternoon. Will?
Yeah, thank you, Robert and Britt. A big question that came in a few moments ago is about big events being held again here in Austin. Mayor and Judge there, do you all anticipate doing anything differently, for instance, when it comes to holding the Austin City Limits Music Festival in October?
Well, I think the guidelines are going to be pretty clear. Again, people need to mask, even outdoors, especially in large groups. If you're not vaccinated, you shouldn't go to ACL. The risk is just way too great. But if you are vaccinated, wear a mask. Certainly, it's a lot safer if everybody does. If you're vaccinated but a high-risk individual, I think the recommendation is going to be that you probably shouldn't go either, unless everybody does what we need people to do. By the time ACL comes around in October, if everybody would start masking, if we could get greater adherence, if more people would take the vaccine, we would see that positivity level go down. That's what we should do to help save those events.
Yeah, and if you compare us to El Paso, which has a vaccination rate of over 70% of fully vaccinated people, and they got there because people were scared. The death rate was higher, the COVID hit El Paso much harder, and so people went ahead and got vaccinated at that rate. And right now, they have a lower problem, less of a problem than we do currently. And so if we can get to that point, to somewhere 70, 80% of our whole community vaccinated, then we can go back to ACL, eating where we want, everything like that.
Okay, thank you to you both. And the mayor and the county judge are going to stay with us for a few more minutes.
Just to have the challenges of leading during a pandemic. Today, Governor Greg Abbott told a trade group at a national convention lockdowns are the wrong response to the pandemic at this point.
The surest way to end the pandemic is for everyone who wants one to make sure they get the vaccine. That said, going forward in Texas, there will not be any government-imposed shutdowns or mask mandates. Everyone already knows what to do. Everyone can voluntarily implement the mandates that are safest for them, for their families, and for their businesses.
Judge Brown, your response first?
Yeah, I think that's great. I agree everyone should get vaccinated, but there's a hole in that plan, and that hole is that there are kids under 12 who are about to go back to school, and the school district's ability to require them to mask is not there. And so we need to think of what we're going to do to protect our youngest, most vulnerable people who can't yet get vaccinated.
Alrighty, and Mayor?
Well, I agree with the governor when he says we don't want to do any kind of shutdowns. The best way to avoid shutdowns is if people would wear masks and they would get vaccinated. And quite frankly, I don't think anybody has the right to be able to make that choice for the rest of us. And people who are not wearing masks and are not getting vaccinated are putting at risk our being able to keep businesses open, the health of our unvaccinated under 12. So I think that there is a place potentially for government to act, and we're taking a look at that.
Thank you so much, both of you. We appreciate your time, and we do appreciate everybody sending us in your questions today. Thank you so much for doing so. We couldn't get them all in, but more on KXAN.
Up next, NBC Nightly News with Lester Holt live in Tokyo.